Hello, my name is Michael Friebe. Welcome, IEEE EMBS North Africa community. I'm really sorry that I cannot be with you, but the German train system is not in excellent shape at the moment, and I basically had to change trains too many times, too many delays, and I missed the plane. So I'm really sorry that that happened. First time in 30 years, by the way, that that happened to me. So I'm yeah, quite frustrated. But frustrated because mainly also because I think that that topic that I want to communicate or discuss with you or present to you, health tech innovation generation in the context of new technologies, is very exciting and might change your thinking on how you want to approach innovation design in the future. So I hope that I'll be able to, with the talk, give you some insights, and I'll also give you a little goodie at the end of the presentation by giving you a download link for one of the chapters that I discussed to a certain extent in this presentation, and that hopefully will help you. I also am available. You can connect to me on LinkedIn, and I'm always very responsive by emails. So please don't hesitate to send mails if you have any further questions or like to have any additional information regarding the things that are discussed. So let me share my screen and start with a presentation that's titled Innovation Design with a Purpose and Method. Why I say purpose is because I believe that the current way of doing innovation, making things a little better and kind of like, doing it in the context of the current healthcare system is not the right thing to do anymore. I'll also give you reasons for that. And I also believe that exponential technologies, all the things that come up right now will change the way we think, do, act in healthcare dramatically in the next years. I also present you very shortly at the end a method of actually dealing with innovation, managing innovation, and maybe improving the ideas that you have with respect to a market and acceptance and maybe scalability in the future. So this is what I just said. So basically, what we should look at in healthcare is also not only looking at our little area that we live in, but also in a global healthcare context. So one of the things that obviously should come out at the end of this presentation is what are the global or what are the development goals that we should thrive for that are, should be the motivation for our future work. And I will also present you some ideas on this one. So what does the future of health look like or healthcare look like? Is it completely digital? Is it like, imaging to a certain extent, diagnosis, or is it maybe something else? This is a little animation stolen from General Electric. Quite clearly a General Electric image. The very great company, but that's what they focus on. That's what they see their future in. On the other hand, there is a lot of futurists among them. Somebody I very much appreciate and follow, Ray Kurzweil. He used to be the Google Innovation Vice President, and he's also the founder of the Singularity University. Somebody who's been often right in his predictions. And he says that we will see as much progress in the decade ahead, so the next 10 years, than we have seen in the last century. I think there's enough evidence that that will happen. If you look at the developments, improvement of CPU speed or algorithmics, the artificial intelligence that is possible because of that, everything. Things we see in the biology, in synthetic biology, in genetic engineering, many other things. I'll have a little bit of an overview on these technologies as well. So there's a lot of reasons that that will actually happen, maybe even more than in the last century. I've actually written this up in a book, so I apologize for this little advertisement here. So if you're interested in looking at some of the future aspects and looking at some of what the novel innovation design should be for a future of health, you're very welcome to get that book. It's not an inexpensive book. That's why I also gave you a chapter at the end. And I also have people like Peter Diamandis who, very much looking forward into the healthy longevity space, be part of this as a forward writer and as a supporter. So, what is driving health innovation at the moment? And it's very interesting that if you ask a doctor, for example, a radiologist, urologist, or cardiologist, what they want as health innovation, you will always get the same answer. And the same answer is, I would like to have better radiology, or better urology, or better cardiology. This is the typical answer, and there's nothing wrong with it. That's okay. That is incremental innovation. They would like to have the support tools that they use right now in a better way. What does a hospital want? Those are the stakeholders in the system. Hospital wants to have more efficient processes, the workflows improved, also processes, maybe also additional tools, reduce cost, maybe a compensation for the lack of staff, whatever. They want a lot of things that are around this business of healthcare delivery. What does a health investor want? So somebody who invests in that, a return on investment. What does that require? It requires a business model. So it requires something in place that is actually, giving them more money back than they give. Also, they're all pretty logical, these things. However, these all things don't work together very well. A doctor wants incremental innovation, a hospital wants to reduce cost, health investor wants to have within a business model a return on investment. Ask yourself, what do you want? You as an individual, as a potential patient. And that the real answer for that is you don't want to have anything to do with the healthcare. You want to stay healthy, right? You want to stay healthy. You don't want to be part of the healthcare system. So at the end of the day, what we should do is look for, prediction measures, prevention measures. Personalization is something that is geared towards your condition, not to somebody who is statistically about your age, your sex, your weight, your condition. No, it should be for you. You should, of course, be motivated to participate, and you would like to have a prolonged, healthy life. So it's not only a prolonged life, but a prolonged, healthy life. And all these things should be developed also, with a purpose, covering challenges. And you should also be careful of not ruining the planet at the same time, because all these big equipment, for example, is not necessarily always very sustainable with respect to planetary resources. So all of you should be part of helping a transformation of healthcare from the current setup to a novel setup. However, and that's what I said the investors before, this has no business model at the moment. So there's not a lot of potential return on investment. But if we all want it, it will happen. I'm 100% sure on this. So let's look at the future, because that's part of this discussion here too. There's lots of different futures. You don't have to look at those in detail. A very interesting chart. It's kind of like starts from the left, but that's where we are. And obviously, the more we look into the future, the more uncertain the future is. And there's lots of different futures, preposterous, possible, plausible, etc. futures. And there's some futures you don't want to have and some you would like to have. A probable, preferable future is something that you would like to have. You would obviously not want to have a preventable, awful future that could also happen, or a possible future that maybe only goes for certain benefit certain people, but not the whole global community. So if you don't work on that future that you would like to have, that is preferable to you, somebody else will do it, and maybe they have a completely different idea about what their future should look like. So future discussions are always important. They're also important. Another animation I took from GE. They're always very important if you want to create something, that is better and that is useful in the future. And you kind of look at existing setups. What was it in the past? What could it be in the future? Taking technologies into consideration. But I'm not sure that the future of the healthcare should be in a hospital. Um, we have some ideas already how that could look like. Robotic surgeries, we have smartphone ultrasound, but organ brain. But if you look at that, it's always the same. It's better diagnosis, so diagnosing patients, what they have, what they should be treated with, and then doing the therapy. And maybe even if you think a little further, doing the rehabilitation afterwards. But there's nothing on this chart here and nothing in the hospital that prevents things from happening or keeps you healthy. Keeping healthy is not a good business model for a hospital. They will not see you. right? You will not be sick. You will not go to them. That's their business model. So anyway, I have some examples. I think it's always like I'm an MRI physicist, so I love MRIs at the end of the day. So here's, for example, the newest thing. It's an MRI linear accelerator combined, and there is some. You don't have to read this, but it's very interesting to look at it because the president and the CEO of the company that provides the MRI and the linear accelerator said it's the greatest thing in the world. It will change everything. And the question is that really, are you serious? Is that something that will happen everywhere and that should happen everywhere, where you actually do have a performance of an MRI added to a performance of a linear accelerator? So they're both individual systems, and maybe you have a benefit for 10, 20, 30% of the patients, probably less than that, actually, a real benefit. On the other hand, if you add the cost of the MRI and the cost of linear, you end up with a cost that is significantly over that cost of these two individual systems. So look at that. It only benefits a small number of patients. It costs a lot more. That costs a lot more is something that maybe the community even has to pay. The healthy community has to pay. I'm a big fan of social medicine and social paid medicine, but I'm not sure that that is a fair approach. And that is an approach that we should thrive for. Always make things more complicated, more expensive. But this comes from a medical technology equipment manufacturer, and that's what they have to do. They have to provide better features, better systems, because that's what their business model is like. But you have to always look at that these kind of benefits need to, at the end of the day, provide benefits to everyone and to the clinical user, sorry, and mainly to the patients. And that's not always clear that that is the case because these 10% added benefit have to be paid by everybody else and they have to be supported by everybody else. So it's not a support for everyone. It's a support for just a very few. And that also, could raise the gap between the people that can afford certain technologies and cannot. And I'm not sure that that is the thing that we would like to have. So there's a lot of these future talks. And I just wanted to point out one thing that's almost 100 years old, the Doctor of the Future from a person called Fritz Kahn. And he already designed the human being as a kind of like an industry machine. Again, that goes against personalization, but he also had some vision ideas of what an operating or a support room should look like. I'm not sure if he has a cigarette in his mouth, but that could be, well, that's obviously 100 years ago. But some of these ideas are still not around in all these areas, but the thinking about future and how healthcare should look like is around for a long time, and it will certainly be something that we will see for the rest of our lives because health is closest to ourselves and it's probably the most important thing we can maintain for ourselves and for others. So healthcare will change a lot. We've heard that a lot, and everything changes around it. Healthcare is something that not necessarily wants to change, and on the other hand, it will have to change because there's all these novel ideas around, these novel concepts around, and change is really needed in that system that is really close to the least digitized environment, the least forward-looking environment with respect to what we want to have as users rather than what the system wants to have. And part of that is we also need to change the way we approach innovation and the way we actually do education in that segment. So some numbers just to highlight some of the issues. I don't want to go into detail here. It's just, I think if you just look at that, it strikes you very much that, for example, the healthcare spend has increased by a factor of 20. The drug, most expensive drug by, I can't know, 500 times. The time that people spend with, that healthcare workers spend with a patient has dropped on the other side. So it has gotten a lot more expensive, but not necessarily a lot more empathetic and a lot more human. And cost is a big, 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 big issue. So is it really that cost is our biggest problem? Well, it is one major problem in global healthcare. We also have these non-communicable diseases that will, increase even more. They will, take up a large chunk of the money that is spent in healthcare they will actually do cancer, diabetes, cardiovascular disease, chronic pulmonary diseases. Now, if you look at those, most of them are preventable or at least significantly reducible if we adjust our lifestyle and if we do preventive measures. So we could save a lot of these costs and obviously negative issues for the patient by actually addressing these earlier on. So is non-communicable diseases the issue? Is it maybe the demographics, how it changes? A lot less young people. I mean, you see the differences between some of the lower income nations and higher income nations here, for example, in Africa, if you look at Tanzania or you look at Germany, this is how it's built. It's still in Africa a typical pyramid curve. And in Germany, for example, we have the older population gains significant amounts of numbers, which also means that aging or demographics is a huge problem or an additional problem. So there's a lot of things that add to that. If you will get old, you don't necessarily want to have a non-healthy life. Just getting older is not the goal. Getting older in a healthy state is the goal. But if you end up having neurodegenerative diseases like dementia that come very common with older age, is that really life quality? Or other non-communicable diseases like things that can be prevented and then they also get more prominent in age. How can we deal with those? So we have to ask a lot of things that are outside the direct health field, but they have to, of course, directly to do with it. For example, nutrition, health education. Everybody needs to know about it. Otherwise, they cannot participate and help themselves. And activity levels. So there's a lot of things, and the question is getting old actually with the biggest risk of dying? Of course it is. But we want to reduce the suffering in older age. Should be a major goal also of healthcare and in the future. So there's a lot of other things that we have to ask ourselves: who pays in the future? Because money is a big issue. How do we move from, I said it before, from the reactive treatment, so diagnosis, therapy, to more proactive prevention? Democratization of healthcare. We want to make sure that everyone on this planet have the same access to systems, same, or at least, useful and good healthcare available to everyone. And many, many more things that we have to address. So there's lots and lots of challenges, and all of these provide international innovation opportunities. And they're not always coming, and they should not always coming from the high income nations. I think there's a lot of needs in lower income nations that could subsequently transfer to the higher income nation, especially since there is a established business model in these high income nations which does not allow, for disruption to come in. But when there is a proven point in lower income nation that things work and things work very well, there needs to be an adaptation by these countries as well. So I think there's a lot of reasons why we should believe in a disruption of health. And disruption, just to give you a quick one, I think I have a chart on this one later on, means basically challenging the existing systems and trying to replace that system with a novel system and a novel idea. There's a lot of people who don't like that, particularly since it's not always clear how that will look like, these disruption. There's a certain amount of chaos involved, obviously, because nobody really knows what happens. But if you don't want to go for disruption, it will always stay the same. It will always go a little better. There's nothing wrong with doing things better, but there is a lot of wrong things with the fact that we keep things in place that could be improved by actually completely rethinking it. So that's what I would like you to also think about. How can we rethink the existing system, and what can we do to make that to allow that to happen? So at the end of the day, and that's a summary of that's not a summary of this talk, but the summary of this problem is the healthcare that I see at the moment where I live does not like disruption. People are, comfortable. The stakeholders are comfortable. They're not necessarily the patient who is ultimately paying for it is not in the center of attention because the whole system circles around the sick people, and it's very nimble. It doesn't want to change, and it's very reactive, very bureaucratic as well, and it's quite expensive. So it's really, and you've heard that before, it's sick care. It's not healthcare. We would like to change it not only to healthcare but to health. So other problems that we have to deal with as part of that, even in that existing setup, are dealing with, what does go wrong? Because I mean, at the end of the day, medical errors are the number 3 cause of death. That's to be avoided. How can you avoid it? Standardization, making things the same, having clear quality procedures, questioning, being open to it. So there's a lot of things that can be improved. And at the end of the day, and that's the sentence I put down, innovation is always identifying the problems that matter and that matter the most. So that's what you have to deal with. And that maybe goes to what I try to say in my other lectures as well, is do not actually develop a technology that has no use or doesn't solve a problem, but try to analyze the problem, try to see where innovation would matter the most, and have a forward-looking perspective to that, and then actually create a technology that solves that problem. So rather than always looking, I'm not saying that we should not look at technology improvements, but I'm looking at it from an applied perspective. Actually, don't throw technologies at problems. Try to understand what the problems need and then have that technology develop for that. So what I do, and it's very exciting, I actually always, with my students, design surgery rooms 10 years from now or 15 years from now. And it's always the same that comes out. It's technology that we know already. But at the end of the day, we don't see very few, we see very few people. We always kind of like see robots. We see kind of like assembly lines, but nobody seems to want to deal with this prevention issue. So they all deal, and that's how they understand healthcare as something that fixes that things that have gone wrong. Again, good thing needs to be done. And this is kind of like foreseeable, but we need to ask ourselves, where is technology best placed and where does it actually do the best job? And I'm not entirely sure if I want that. Remember that chart I showed you with the technology, that what you want, what you can have, probable future, plausible future, preferable future. I'm not entirely sure if that's a preferable future. However, if it's really the best way to do it, then I'll go for it. I also did a little cartoon book on the future of healthcare. It was 2 years ago. It was with hundreds of people internationally. We did it on an online course. It was in the middle of the COVID day, and it's freely available. So if you would like to read it, it's 7 short stories. And interesting enough, there's very few human beings as clinical solution providers there. It's many technology, and there's a lot of biology included too. So it's quite exciting, and yeah, get an inspiration for the future. So my clock is banging right now, but I hope that doesn't bother you. So there's also things that we need to actually question ourselves. Like, for example, when the doctor says you need to get a stent, that at the end of the day doesn't really solve any of the issues. Like, it doesn't prevent heart attacks, and it also doesn't extend the life for stable patients. So it's really, they put it in, but it's at the end of the day done mainly to protect, the clinical provider as well as create some revenue. So there's some of these things where there's useless therapies done, useless procedures done, that we should try to avoid, and that goes on, and we have to question, on whether, I think that has been resolved already to a certain extent. Prostate biopsies, for example, they really don't do much. You can do much more with imaging, but you need to have an MRI around or an advanced ultrasound. If you don't have that, you can't do it, and you maybe need to do other measures. So what is the use of that? And we have to question ourselves as well. And we have to be much more personalized with this approach. So personalized medicine, I think, must be the goal in the future, that we are being treated based on ourselves. So for example, I'm almost 60 years old, but I believe I'm physically like 45. I believe that. So I have no measure, but I believe that. So, but I should be treated according to my condition, not according to my age. And so these are the things that we really need to focus on in the future, also with innovation. We also need to make sure that at the end of the day, we don't add more and more cost to the system. We do excessive diagnosis to protect ourselves, maybe to avoid legal issues. And we have non-empathetic clinical staff. That's just I'm not claiming that that is the case. There's a lot of really, really good people in that system, but we need to make sure that the human element is actually raised and empathized anymore. So again, we're still talking about the same thing, and we need to really, really go about changing and transforming that setup. Now, there's the healthcare innovator's dilemma. I'd like to talk about this. And we are supporting sick care. There's a business model. Remember, when you get sick, the doctor gets paid. When you need treatment, the hospital gets paid. When you need pharmaceuticals, the pharmacy is getting paid. If you need some physical therapy, the physical therapy, all of those have to do with sick care. There's a business model behind it. There's no business model right now with prevention. And I do believe when we want something and we like to actually, we focus on it and we create this new aspects, then there will be a business model in the future. So I personally am betting a lot on this, and I'll invest my own money and time and efforts in that model because I would like to have it. It's benefiting me and the people around me and the whole society, and it will create huge benefits. And that's why I believe there will be a business model. So, and that also comes along with the fact that we need to be significantly more careful about our planet. The less you move patients into a hospital or you treat them with very expensive, costly medicine, the less you actually cause the planet to you reduce the resources of the planet. You use less energy. Every every time you move something in the scale from acute care to home care, it will reduce not only cost, but also it will be significantly more sustainable. So we have to think about how do we empower the patient more to take care of their own health. And at the same day also, and that's also a goal that I have for my efforts, is how do we make sure that everybody on this planet has access to healthcare and to decent healthcare. So that's why we also believe and say all the time that innovation is not enough anymore. We need to think more. And innovation, in essence, is invention times commercialization. So we have to come up with a new idea, and then you find a path to business model. But that business model, if that only supports incremental innovation, we have to think differently. So this is what we need to possibly get to. And those are all hypotheses and assumptions and maybe wishful thinking. But if nobody works towards it, then it will also not happen. So besides the precision medicine, I believe we need to really do something that empowers the patient, and we need to give that patient or that individual the right technologies so they can deal better with the stakeholders. And we need to, I said that before, identify the problems that matter right now and in the future. There will be a difference because if you change the setup, there will also be different innovations needed in the future. And you can somehow predict those as well already. So I just have a little bit of an example where you can do things right now. This is, for example, if you throw AI at certain at certain processes, you can get huge success by actually using AI and deep learning methods and everything else by looking at semi-complex tags, simple to semi-complex tabs that are rather forgiving to errors. So they're not directly affect the life of the human being. So those are mainly the ones in that segment here. These are the ones that are ideally suited, and that's a problem you can address with AI. But again, understand the problem first. There is a lot more applications that will help, improve the workflow, the reduce errors in these aspects that I mentioned here. There's also a lot of business potential behind it. So, look at it again, look at tasks and look at what technology can do to these tasks. And obviously, if you're in the innovation space, you need to look on whether there's some money around it, but also what is the biggest, what could have the biggest impact on healthcare. So Data. I think you've heard that before. We need lots of data, and data will possibly be the gold of the or the oil of the future economy. I think oil, that's what they mainly say, because oil drives car and data drives AI, deep learning, and innovation. So you also need sensors for that, and you need obviously not only thinking about how to digitize analog processes in the hospital, but to really how can digitization and use of these data actually change workflows as they are at the moment. So these incremental setups that we currently do are not doing this healthcare delivery change because they're exactly doing what I said before. They make a analog process digital, but everything else is kind of like left alone and left in place. So if you really look at these incremental innovations making things better, this is the domain of the big players, the General Electric, Siemens, Philips, Samsungs of the world. That's what they can do best. They can do improve their existing technologies. They can make them actually. They can produce them efficiently. They can distribute them. They can market them. They can service them. It's all that we can do, but they're not really that good at thinking about disruption, things that would replace their own systems, and that's also not what they want. Let's be honest. So I think we need to think about how can we, create painkillers that solve burning problems. And I said that before in a little short statement is that don't look at technology, but look at the problem. So that's the painkiller and see, sorry, the burning problem and see what technology could do. So create the painkiller to solve this burning problem. And what we very often do in the technology world is that we actually have a technology, we try to develop and improve this technology, and then we try to find what can we actually do with it? What is the solution that would or the problem that would benefit from that technical solution. So I believe that you guys that you're sitting here in Tunisia, or maybe even on a screen, maybe there's online access a disruption and these really great novel ideas that may change the way that we think healthcare, we do healthcare, they will predominantly come from entrepreneurial and interdisciplinary activities. So where clinicians work together with economists, with engineers, with data scientists, etc. This is the area where disruption develops. Okay, I also, I mean, this is one of the things I just throw this in here because I like this little chart because people always say, well, we need to keep the human element. I agree in healthcare, but when they say like the human is the only one that can do that can show empathy, that it is interesting to see that at least it's probably statistically not relevant using 200 patients. But they thought these patients that the responses given to them by a ChatGPT or a large language model a response system were more empathetic than the human response. Not bad. So you can replace certain responses as well with ChatGPT or with large language models. But again, I'm not trying to get the human out of it. I'm just trying to say that the human has to concentrate on areas where the human is really good and needed. Complex decision making, for example, that is something I would not use ChatGPT for, or guiding patients, helping them, and maybe also guiding them with the process of how to achieve a long and healthy life. Those are the kind of things that the human is probably is much better suited, and that's also a domain that a large language model likely will not achieve in the next decades. Okay, this one I said before, so this is a little formula that I don't look at the details on. It's basically saying is the healthcare outcome and the healthcare innovation has to do obviously with the amount of data that we generate, and the future value needs to be something that the future value is directly associated to the amount of data. So we need to create more and more data, and there's legal issues, there's ethical issues behind it, also something that we need to consider. But it's not just AI. There's lots of technologies out there that could help us improve healthcare. There's just 30 technologies that I copied out, and also the ones that I believe are most applicable to healthcare innovations. But it's not only looking at single technologies, it's maybe even wiser to look at the convergence, so the use of different technologies at the same time. So robotics by itself may not really do that much. Robotics combined with advanced sensors, IoT devices, and artificial intelligence and deep learning and forward-looking, that is what will possibly be able to create a semi-autonomous or autonomous system rather than right now as a robotics as a telemanipulated human system. So if you think in terms of like this convergence of using different technologies at the same time, this exponential technology will be possibly double or triple exponential. One of the things, and I know there's people in there that in the room that are much more experts than I am on the biology phase, but this is a chart that is from 2018 already. It was from Peter Diamandis, by the way, the guy who wrote the foreword to my book. It's like that. By the way, it's much easier to read DNA and genes than to write them. But I think we'll get to that point that we can write DNA, we can edit it. And if you think about that, 32,000 out of 50,000 diseases are caused by a single point mutation. You can also think of, okay, if I'm able to fix that, I can completely prevent this disease from happening. Just by the way, just because you have a gene mutation doesn't mean you get that, but you have a higher likelihood of getting it. So if you combine now, and there's also convergence, if you combine like AI with advanced diagnostics, digital biology, genetic engineering, we'll likely, get to a paradigm shift in healthcare delivery, preventing and not happening anymore. Think about what kind of consequences that will have. This is also something that I took from San Diego. It's human longevity. It's basically, it's something that's not available in most places in the world because it's quite expensive. You basically use genetic clinical imaging information, so a certain set of biomarkers. You combine that in a health intelligence engine and try to actually analyze what is wrong right now, if there's anything, and what you can do predictively and preventatively in the future, and you can always add new information to that. Also something that may lead to a paradigm shift if we do more regular diagnostic evaluations and then feed this data into these kind of AI programs. So this is kind of like leading to the discussion of exponential technologies, where you always have a digital starting point. So a mechanical device technology will not ever be able to scale exponentially because it's always one by one by one, while exponentials, obviously, the more digits you add, the faster things go. The smaller you make it in terms the more you can store, the more power you have. So there's always this digital component to it. And typically in the first phase, well, something like a disappointment phase. So where technology is promising, I'm pointing out maybe quantum computing. We all know quantum computing is the great thing, right? But does it really do anything right now? Is it available? Is it costly? Is it affordable? Can you actually put it in your room? Does it do anything that you would only be able to do with quantum computing? Do you really need it? It's very disappointing at the moment, but we all know it's going to come to a point where we really will use this technology because it will continue to develop and it will disrupt the existing linear technology. Well, the technology that we use right now is also not linear, but it will disrupt it. And eventually, sorry, I was too fast. Eventually, it will also get smaller. It will dematerialize. It will actually be cheaper. So when you build volume, you'll be able to reduce the cost. And with that, you will actually open it up to everyone. You will democratize the technology. So these are the 6 steps of digital techno of exponential technologies. Also, gratitude here to Peter Diamandis, who actually came up with that concept as well. Apply this to this combination of the items that I put down here on the side. You can not imagine, but maybe you can at least a dream about what that could do to healthcare in the future. Okay, here's a little more explanation on this one. So what does that mean for the future of health, innovation space, and value proposition? I believe we'll have a value-based care model in the future where technologies need to prove that they actually do something that significantly reduces the the pain point of the patient and actually has also an economic benefit. We will also need to, always find pathways to commercial acceptance. That's why this value-based and commercialization has to, work together. And please also, I'm an engineer myself, but I also have a business degree. So engineers need to stay in touch with economics as well. It's a very important feature. If you don't understand the economics, you may create really cool technologies. They may even be useful, but if they don't find a pathway to commercial acceptance, it's difficult. Okay, you need to look for opportunities where exponential technologies may have a huge impact on health and then develop that new technology together with the problem space that you have analyzed. And I just believe, even though I said about you need to find that commercial aspect, it does not need to be in place right now. You need to be able to anticipate and you need to do something which we call customer development or market development. You need to move the market and the people to a new business model if that's really the case. If you really believe in it and it's really something that's cool, that's what needs to happen. So I do believe that this 5P model that I made to you before, that I showed you before, makes a lot of sense despite the fact that it has no business model yet. And that's why I personally will invest in this. And I will personally believe that there's something that will happen. So future trends, it's kind of like we're getting a little bit to the end now, is what do I recommend you to do as engineers, as biomedical innovators? Look at the future trends. So this is the future look. Prevention, access risk profiles, you need to integrate technologies, cheaper transplant, et cetera, et cetera. There will be a much later transition point from things you do at home. So home care will be a big issue. What can you do at home? How can you actually manage your own health? And at some point in time, there will be a transition point into professional care. So there will be still hospitals, there will still be ambulatory care, there will still be specialists, there will still be additional diagnosis, but it will come later. And that transition point, that shift of that transition point will shift also the business models and will also shift sustainability issues, will shift where people work and how they work. Think about this as well. So adding this all up, from a device perspective, it obviously needs to be effective what you do. So there needs to be an unmet clinical need behind it. Doing things that are more expensive than right now, I think is a no-go. At least if you want to look at disruption, it needs to be dramatically cheaper. It needs to be easy to use. So complexity is a killer. Small, obviously needs to be connected and intelligent and scalable. All obvious things, but if you really look at it, people love to do complicated things and they love to do expensive things and they love to do, making things better because it comes with a lower risk. So I put some of these things together. It's an old drawing, an old figure of mine from 2017, but I just wanted to, kind of show you again all the technologies that will help you actually get this done. We already have a lot of things that potentially could, for example, be a novel doctor's bag. But if you see right here, there's like 3, 7, 5. So it's 11, 12 different devices. We need to integrate these things and we need to make them maybe even available for our own use at home. So also please think about, and I do that too from a high income nation perspective. I think about how can I make things so that maybe they're only 90% good or 80% good, but in most cases that's sufficient, but reduce costs dramatically and so make it available for everyone else. Now, what I'm trying also to do is I'm trying to change curriculum and actually, try to train engineers and clinicians at the same time and working together interdisciplinary and coming up with novel ideas from their different perspectives that fit together very well. We need to think about changes in education as well on this one. And of course, that's one of the things that I mentioned at least 5 or 6 times here is look at the left, Dr. Reddy is ready to see you at your convenience and at no charge. We need to make sure that there is also a future business model in that case, because if there's no business models, people will not like to develop it and they will not put their efforts in it. So again, it doesn't have to be right now, but it should be in the future. And thinking about healthy longevity is obviously something that, there is a business model. People are really starting to invest in it. There's a couple of people that I also work with, and Nina Rug is the German lady on the right. So they're very much into this increased human health span, longevity, and there's billions and billions of euros, dollars put into this. Also, the disruption and the healthcare democratization that I pointed out are meta trends in this field. And in that respect, I would like to mention this reverse innovation process very quickly, which says that at the end of the day, if you look, for example, in Tunis or Morocco or in Algeria or in Libya or in Egypt or in the Middle East, you look at what are the most prominent needs, in your healthcare space, and you actually try to develop tools, algorithms, combinations, sensors to address that issue. You need to make it cheap. You need to make it easy so people accept it. And once that's proven to work in your area, you can try to put it back into the high income nations that need to accept that because you already proven a point. That's what's called reverse innovation. You develop somewhere else and then bring it back to other areas as well. So let me just get a sip here. So summing this up as development goals, I think most of the things I've said already. That's why I just give you 3 seconds, 1, 2, 3, with this chart. So you actually get it into your, maybe, it brands into your head and it sticks there, what the development goals are. So finally, last but not least, I want to quickly show some innovation tools, and that what I said before, develop with a purpose. That was the purpose part I just did, and a methodology. That's the methodology part. What I use in my development process, in my teaching, and in my own ventures is I use all kinds of different tools, design thinking, bio design. So that would be the design thinking part. Bio design is this one here. Then we have an exponential canvas. We have a value proposition canvas, business model canvas, blue ocean, lean engineering. These are all excellent tools and they're all good, to get certain things done. But there is no comprehensive model behind it. So what we did, and that's an effort by mainly a guy called Francisco Palau from Spain. He started a purpose alliance, and what we did together with many other people there is we defined a novel methodology that basically I'll go with this one, that basically tries to put an innovation process into 8 segments. So we need to have a purpose. We need to address people. We need to understand who our customer is. We need to have a business model behind it. What is about scalability and actually reducing resources. Have good processes work with this. Obviously, create a product that you can show around and get feedback and have meaningful metrics behind it. If you use this in 3 different phases: exploration phase, finding out what needs to be done; evaluation phase, how do we actually check on whether we did the right thing; to subsequently an impact generation phase, and have different tools that are measurable and put together, then that could be a really good way of steering innovation in the right direction. So these are some of the frameworks and ideas that are combined in this Purpose Launchpad Health. And I mentioned some of those in 2 slides ago already. But what I did, and that's the thing that I'll give you as a goodie, is I wrote, as part of the book I wrote, I basically designed a setup where certain tools are needed for each one of these segments: purpose, people, etc. And if you really use those and subsequently validate those, you can actually get into a process that helps you not only to identify what matters most, the customer, what matters most, but to also create a product that is subsequently being validated. So you can invalidate it, and then you change it again and apply it again. So this is a little bit like a lean process. And if you do this correctly, you will actually get to a point where you can then get a visual radar that shows, well, right here, we're already doing well. We have done quite a bit on the purpose, on the people side. We have to work on the customer, on the abundance, on the business model, on the metrics. And you create yourself or with a mentor a backlog of things that need to get done by a certain time or by the next time. It's kind of like a little scrum process combined with an innovation process. And that also helps you initially formulate your ideas, formulate like a one pager with an elevator pitch and basically summarizing opportunities, the technology used, and the impact it will generate, and will create a feedback system that allows you to subsequently dramatically improve your product idea and points you in the right direction, shows you where you're not doing well and where you should improve. So this is the download link. I'll keep it up. So you're going to use your cell phone camera and then get it downloaded. It's on my Dropbox, and again, it's a one of the chapters, but it explains, I think, it rather well of what I just tried to communicate. Okay, most important learning points. This is really the end now. Technology will create disruption. So don't expect that continues right now, that we only work on incrementals. And personally, I'm not interested in incrementals because they come with low risk and need to be done. And there's people who can do this much better than me. But if you really want to look forward and create something that has a meaningful impact and a big impact, you need to think disruptive. And these disruptions will also create new business models that initially come with chaos. And you need to deal with this chaos. And sometimes chaos cannot be foreseen. You don't know what really happens. But if we want prevention, prevention will happen. And the business model will happen. If we want healthy longevity, which I assume we want, there will be a business model and that will happen. So this requires, however, that you have a future look and you have a purpose on it. So those are learning points. I hope that you get into create yourself a purpose. And you need to have a plan for a transformation that happens. So, there's this old saying, if you don't have a plan, you can't change it. So if you're not prepared for a transformation, you are really then lost, and your idea may be lost as well. And please don't forget that health is a global challenge. It's not only limited to Tunisia or to Morocco or to Algeria or to Libya or to Egypt or to Germany. It's a global aspect, and there's different people that have different needs, and there's people that might have a much different need than what you think is valid in your own place. And I think it's what we need to look at it, and what we need to deal with is that we should do things for the individual user in the healthcare system, which is us, all of us, rather than only looking at the financial stakeholders and the current stakeholders in that. And with that, I am done. I thank you for your attention. Here's my email address. You can also connect to me on LinkedIn through this link. I'm very happy to accept you and to take you on the future journey of health innovation and disruption. Thank you very much for your attention.